as we have since the beginning of this pandemic. In response to this increase in cases recently, our staff continue to work very diligently on contact tracing and case management. As always, we also continue to communicate frequently with our partner agencies, including SUNY Plattsburgh, Champlain Valley Educational Services, and CVPH. As a side effect of the New York state of emergency being lifted, funding and support for many services in our county have been equally impacted. This has meant a bigger load for our staff to take on, including contact tracing, support, vaccinations, and most recently testing for those in the public without insurance or a medical provider. Please note that the CCHD offers free vaccinations every Thursday from 10 a.m. to noon at our offices at 133 Margaret Street in Plattsburgh. Vaccination pre-registration is always preferred, so please call 565-4848 to schedule a vaccination appointment. Currently, third dose shots are available for immunocompromised individuals, that being third dose shots. If you believe you are eligible, you can now contact your healthcare provider, primary care physician, local pharmacy, or local health department, CCHD, to schedule your next vaccination. Booster shots for all other vaccinated individuals, the remainder of the public, will become available this fall as our residents approach the 8-month post-vaccination mark. We ask you to be patient in the coming months as we learn more about how this rollout will take place. Testing resources in our area have been greatly reduced with the closing of the state organized free testing site. However, there are local providers offering testing in our area. Symptomatic individuals, those who have one or more symptoms of COVID-19, should be under the care of their medical professional, their doctor. If you are sick, contact your doctor to seek testing. If you do not have a primary care provider, doctor, you should contact a local urgent care center or the hospital. If you are not sick but need testing due to an exposure of COVID or for travel, contact your healthcare provider, local pharmacy, or urgent care center for testing. If you do not have health insurance or a primary healthcare provider, you can contact us at the CCHD for testing assistance by calling 565-4848. Please visit our website for a full list of all testing providers, their schedules, and the costs of testing. Our website is www.clintonhealth.org/COVID-19. If you require a test because you are planning to travel, according to our latest information updates, the Kinney's Pharmacy on New York Road and at 288 Cornelia Street, as well as the Walgreens Pharmacy at 301 Cornelia Street, can provide testing for you. It is always recommended that you either call these pharmacies first to confirm that they are currently, on the day you want, providing such testing, or check out their website. Please note the CCHD will not be providing testing specifically for travelers. Overall, Clinton County has a pretty decent vaccination rate, with 72% 18 years and older having already received at least one dose. However, that still leaves almost 30% of our residents vulnerable. I can't stress this enough. Please get vaccinated if you are eligible to do so. Of our various population age groups, we are especially proud and thankful to our population 65 and older, who have a vaccination rate over 90%. That is very, very impressive. Regardless of vaccination status, CCHD continues to recommend all residents wear masks when you're indoors. Avoid crowds and high-risk activities, wash your hands frequently, and again, get vaccinated. Getting vaccinated reduces your chances of contracting COVID-19, protects you from severe illness requiring hospitalization, and helps to eliminate the virus's ability to mutate and create new variants. With that, I am going to turn it over to our next speaker, Dr. Mark Davey from Champlain Valley Educational Services. Thank you again.
Thank you, Mr. Canosa. Good morning. Today, I want to outline the plans that we at CVS, in collaboration with our 16 component school districts in Clinton, Essex, Warren, and Washington counties, have made regarding the health and safety of our students and staff for the upcoming school year. The first day of school is just around the corner. For CVS students, it's September 7th, though our staff will return on September 1st. The first thing I want to emphasize is that all of our 16 component school districts and CVS itself will be opening with in-person instruction. I want to repeat that. We will begin the school year with face-to-face instruction. At this point, we have gained valuable experience over the past 2 years in preparing and maintaining a healthy and safe school environment. In March of 2020, CVS and its component school districts, along with our Clinton and Essex County Health Department colleagues, our Clinton County and Essex County executives, as well as the infectious disease experts at CDPH, developed a common response to this new pandemic. We put together plans for creating and maintaining a safe and healthy school environment and for delivering high-quality remote and hybrid instruction. The collaboration continued throughout the last school year, 2021, and we are now entering our third school year impacted by this pandemic. At this point, your schools, your county health departments, and your public officials are seasoned veterans with this battle to maintain the health and safety of our students and staff while providing education that our students need and deserve. We want to thank our county health department colleagues and for their continued close collaboration with CVES, with our component school districts, and in helping meet weekly to discuss important and school matters of health. Often we speak daily. CVS is proud to facilitate these meetings. We look forward to continuing to do so in the coming year. Together, we are a year smarter, we're a year better prepared, and vaccinations have been readily available for some time and continue to be available to any adult or who wants one and any child over the age of 12. Kudos to our Clinton County and Essex County Health Departments for working with schools to provide vaccination clinics to interested students with parental consent and our school staff. Not only are we now better prepared, but this year we're going to raise the bar in terms of our instructional approach and again provide the highest quality instruction across the northbound country and to provide in-person instruction all week long. It is essential that we work with you, our families and our parents and our communities to keep our students safe and our staff as the highest priority. Concerning the mutual agreements reached by CVS and our 16 component school districts, I'll give you a brief timeline. On August 4th, we received word from New York State that no obligatory guidance was forthcoming for the opening of schools from either the Department of Health or the New York State Executive. It was recommended that we base our plans for opening school on guidance from the CDC and the American Academy of Pediatrics. Their links are available on CVS's website. The following day, August 5th, the chief school officers of our 16 component school districts and I met with our senior CVS leaders to collaborate and create a series of agreements based on the CDC guidance for prevention of COVID in our K-12 schools and the American Academy of Pediatrics COVID guidance for safe schools on addressing these potential issues in our schools. These agreements were sent to our Clinton and Essex County Departments of Health for review. A week later, last Thursday, August 15th, the New York State Education Department issued the New York State Health and Safety Guide with recommendations based on the same documents. We have continued to meet weekly with our Clinton and Essex County Health Departments to review and confirm these recommendations. Both counties' departments of health have given a deep dive and look at these guidance and our recommendations. We are in alignment with both counties on the reopening of our schools and the New York State Education Department respectively for our schools. The Clinton County School agreements have been endorsed by Mr. Canoza and his team with a few minor updates. Similarly, the Essex County schools have agreed to follow the New York State Education Department's health and safety guidelines as distributed last week and in agreement with our schools agreements. The important part of these agreements are as follows. First and foremost, universal masking. All staff, students, and visitors in our school buildings and buses will be required to wear masks regardless of your vaccination status. Second, physical distancing, maintaining a minimum distance of 3 feet between students in classrooms, although 6 feet is preferred. Maintaining the 3-foot distance allows us to return fully with in-person instruction. School leaders should keep in mind that they should not exclude students from in-person learning to keep a minimum distance requirement. The cafeteria, 6 feet distancing is required, or stricter quarantining procedures will be in place. Masks should be used by everyone in the cafeteria, all students, when not eating. COVID testing in schools. This is a new topic for this year. Both the Clinton and Essex County Health Departments have worked with their county schools to use the New York State Department of Health epidemiology and laboratory capacity, known as the ELC, school COVID testing programs funded through allocation monies, to create and operate a pooled testing model to help monitor unvaccinated students and staff and to provide symptomatic testing in schools. These planned approaches are all designed to keep our schools, students, and our families safe. CCHD, the Clinton County Health Department, has contracted with Champlain Valley Educational Services to coordinate COVID testing in the schools, in each school in Clinton County, public and private. The Essex County Health Department, ECHD, will be operating the ELC program to coordinate with their county schools. More information on this initiative will be coming forward from your individual school districts. Daily screening. It is a best practice that parents continue to monitor at home their children's health status. Students and staff who are ill should stay home. Fully remote option. This year it is not required. School districts are planning on operating fully in-person instruction this fall. Let me assure everyone that we do have plans in place, if necessary, to change our instructional model. However, if we are directed by our county health departments, the New York State Education Department, or the New York State Department of Health, we will change and follow that direction immediately. Another topic that's near and dear to everyone's heart is athletics. We understand the importance of athletics to our youth and to our students in high school and middle school. Fall sports will be starting next week. Outdoor sports do not require masking. Athletes are encouraged to be vaccinated, and high contact sports will be monitored for infection rates. Indoor sports will require masking, including athletes, coaches, officials, and spectators. In short, everyone must be masked at indoor sporting events. Spectators, again masked, and 3 feet physical distancing where practical. Vaccinations. All eligible students and staff are encouraged to be vaccinated. And then lastly, monitoring and quarantining. Our county schools continue to work closely with the Clinton and Essex County Health Departments. We will continue to implement many of the successful practices established last year for the prevention of COVID. Screening, hand washing, masking, cleaning and disinfecting, staying home when you're sick, and working with CCHD and ECHD to support their contacting their contact and quarantining efforts. Lastly, on behalf of our Clinton and Essex County schools, we are all looking forward to the return of our students and staff. We encourage all North Country students and our parents and family members to monitor your local school district's website and look for the reopening plan updates and information. We are proud, I am proud, of our school leaders, of our boards of education, and our exceptional staff that we have a strong tradition in the North Country of high-quality education and programs for our students. Please be aware that your school leaders and our CSOs, our Chief School Officers, are working closely each week with our health departments to provide the safest possible school environment. We will continue to provide updates and keep you informed at the start of the school year. Thank you.
Thank you, Dr. Davey. I would like to now introduce Dr. Alexander Agnetti, SUNY Plattsburgh President.
Good afternoon, or good morning, Clinton County and the community. Just want to begin by saying that SUNY Plattsburgh owes a great deal of its success and its opportunity to stay open last academic year due to the incredible collaboration, support, and guidance that was provided by the Clinton County Health Department. And we owe a great debt of gratitude to John Canoza and to his staff for being wonderful partners in being able to help us navigate what was, in many ways, a very interesting opportunity to help our students be successful amidst the pandemic process. At the moment, we're working towards a healthy and safe restart. And I want to emphasize that everything that we've done with our planning begins with the community, the health of our community, the health of our students, and the health of our faculty. We have a restart plan that's been published. It's available on the SUNY Plattsburgh website. If you go to the homepage, it's a tab that you can discover at the top of the homepage. That restart plan is robust. It builds on the plan that was developed 1 year ago. It adds information and details of what we now know with respect to COVID and how best to mitigate COVID in an educational and academic environment. We've been preparing for the fall semester all summer long. I can emphasize again, we have over 100 individuals on our campus who are working and have worked to put the plan together. This has included ongoing development and refining of our COVID-related guidelines to support, again, all safe campus operations and to deliver a full educational experience while accounting for ongoing public health risks of the pandemic. And I want to emphasize that as a residential, comprehensive college campus, we are focused on providing in-person instruction and persistent interaction among students and among faculty and among staff to the fullest extent possible. While a vaccination requirement for all students is still pending FDA approval, vaccinations are required for students participating in certain portions of campus life due to the heightened health and safety considerations in these areas. Specifically, this includes all living on-campus housing, those participating in collegiate club and intramural sports, as well as those students with clinicals and off-campus placements which carry such rules. Students are afforded exemptions for both medical and religious purposes, as well as we're providing temporary exemptions while completing the full vaccination process. At the moment, we have a portal that's just become available that allows students to upload their vaccination information and status, and campus will be holding 2 vaccination pods next week for students and an additional vaccination clinic on September the 1st. Question has come up in terms of proportion of students that are vaccinated. We're still collecting that information, but if you allow me to regale you with some anecdotal information, as we approached the end of last semester, student survey indicated that 75% of the students on campus had a vaccine. When we did commencement, which required either a negative COVID test or vaccination status, 84% of our students graduating had been vaccinated. So we were very pleased to know that the vaccination rate among the students was mirroring the success that was happening here in Clinton County. What can students and staff and faculty and the community expect for our campus? We will continue testing, and we'll start with masking as well. There will be daily screening that continues for unvaccinated or partially vaccinated individuals through the signage that's posted at the entrance of all campus buildings. And there will be instructions not to enter if an individual answers yes to any of the questions. There will be mandatory weekly surveillance pool testing, which will continue for unvaccinated or partially vaccinated employees and students. And I would mention that the PCR test that we're running on campus is the pooled saliva test that was developed by SUNY Upstate Medical. It is now an internationally recognized mechanism to assess the presence of the virus. And this PCR test is now capable of doing sequence analysis on the positive samples that we will see on our campus. So that's an additional tool that's available to keep our community safe. Also, due to the increased prevalence of new variants and recommendations in the most recent CDC guidance, as the semester begins, we're going to return to requiring face coverings indoors. So I'll repeat that. There's a mask requirement for all indoor spaces, and this will involve everyone on campus to wear a mask while they're indoor, regardless of their vaccination status. And this becomes effective beginning Monday, August the 23rd, as the campus density and the semester operations gear up. And it will remain in place through at least the first 2 weeks of classes, and we will make an evaluation prior to Sunday, September the 12th, how this will proceed. During this time, the mask mandate will be evaluated, obviously on the vaccination status, the positivity rate, not only just on campus, but also within the community, and other factors. The status will be communicated to the campus with respect to the mandate for the masks. One thing that we will emphasize is that unvaccinated individuals will continue to be required to wear masks and social distance when indoors on campus. Our students begin to move in next week. Actually, August the 25th is the first official day for student moving into the residence halls. And we will have a staggered move-in piece based on a reservation process that housing has organized. Classes begin on August the 30th, and we anticipate that we may, I'll say this, we reserve the right to do mass testing or testing of every individual on campus throughout the course of the semester. So at the moment, we will be running our surveillance testing on specifically unvaccinated individuals throughout the semester, and this will be week by week for the entire 15-week semester. But periodically, there may become a necessity to test everyone on the campus to ensure that we can identify asymptomatic individuals. The last thing I'll mention is that we have a robust isolation and quarantine capacity on our campus. We have a total of 161 rooms that have been set aside that will serve on-campus students who become infected or identified through contact tracing to necessitate their being placed into quarantine. So that's a brief summary of what's happening at SUNY Plattsburgh. Again, if you're curious and you want more information, I would urge you to visit the website of the campus. You'll find our complete restart plan that covers all the points that I've raised today and other issues that the plan covers, for example, in terms of cleaning and sanitation. So with that, I'll turn it back over to Joe. Thanks.
Thank you very much, Dr. Ignetti. I would now like to introduce Dr. Keith Collins from CVPH.
Thank you, John, and thanks for giving me another chance to come up and sort of update you guys a little bit about what's been happening in our hospital and in our community. We're going to take this off. So before I get started, I just want to say personally for the past 18 months, I can't thank our hospital staff enough for everything they've been doing. They're still doing. That said, I also just want to say from a personal note, I've watched 2 people die in our ICU this past month who were, it's preventable, who were not vaccinated. It does kill people. COVID-19 kills people, and the only tool we have to prevent these deaths is vaccination. All the treatments we have are only at best modestly effective. Our best way of preventing and stopping this virus is to get vaccinated. And for that reason, I want to thank the 72% of the people in Clinton County who have been vaccinated, and I want to beg the 28% who have not been vaccinated to please get vaccinated. I'm going to give you a little bit of things about the vaccine again. I'm going to talk a little bit about getting a booster shot. And I want to talk a little bit about the Delta variant in and of itself. So let me just start with the Delta variant. I don't really, even though I know we can't test for it, I know it's here. And the reason I know it's here is because the Delta variant is much more contagious than the previous Alpha variant. And I take calls from 3 different hospitals day and night in their emergency rooms, and they call me up with their COVID cases so that we can discuss what to do with them. And I can tell you the number of calls I've gotten over the past month has skyrocketed. So I don't need a sequencing test to tell me Delta's here. I know it's here. So to give you some idea about Delta in and of itself, the symptoms are a little bit different. The loss of taste and smell is not as common as it was with the Alpha variant, the original variant. It seems to cause more headache, more sore throat, and more of a runny nose in people than the original variant did. The time frame from when you get infected to when you get sick is shortened. It was the previous period was about 7 to 8 days after you got infected. This variant seems to make people sicker sooner in day 3, day 4. It also affects younger people, and there are definitely people being hospitalized, including children, with this Delta variant throughout the country. And I'm sure you've seen that and you've heard about this. The last I heard, we were up to about 130, 140,000 new cases of COVID in the United States now. What I will also tell you is the vaccines definitely help prevent you from getting hospitalized. I looked at the data recently, and you were 25 times more likely to be hospitalized with COVID-19 if you were unvaccinated. I have seen no deaths in anyone in our area who has been vaccinated, and I've seen very, very few hospitalizations. So I think the vaccines, as we were just talking about, the vaccines work. They prevent you from getting sick or dying, sick enough to be hospitalized. Even without a booster, they're doing that right now. They are still protecting us from being sick enough to be hospitalized and from dying of COVID. The reason that we're talking about doing, that the CDC and NIH is talking about getting booster shots is we now know that around 8 months in, the level of antibodies starts to go down, and in fact, the number of breakthrough infections that everyone has heard about, it's mostly in people who were vaccinated in January or February, like myself. I was vaccinated January 7th, and our immunity starts to wane a little bit. So it's not that you're likely to get sick, but you can get infected, and unfortunately, you can pass that infection on to someone else who could get sick. You could maybe get mild symptoms, but you're not going to get hospitalized. It's exceedingly unlikely. Less than 2% of people who have been vaccinated, I think, around the United States have been hospitalized, with the exception of people that are immunocompromised, like transplant patients. So again, I can't stress vaccination enough. And I think that the whole breakthrough infection thing it's important, but keep in mind the vaccines are still protecting us from getting sick. They may not be totally protective of you getting infected if you're about 8 months out. And so that's the rationale for a booster. The rationale is that we don't want you to get infected and pass it on to someone else. And we don't want you losing so much immunity that you could potentially get sick. And so I think one thing that's going to come up, I've already heard it in my hospital among staff, is if I get a booster, am I going to get sicker than when I got my first shot? And of course, that's understandable for someone to worry about. And I can tell you that Israel has already been doing this for about a month. They've had over 4,500 people over the age of 60 who have gotten a second dose of a messenger RNA vaccine, that would be Pfizer or Moderna. And of those people, they either had similar or less symptoms than what they got with their second dose. So I think we can expect that, for the most part, getting a third dose is not going to put you down and out. I think you're going to be fine. And I think to protect us, a third dose makes total sense. especially for healthcare workers and frontline workers, because what we don't want to do is wind up getting asymptomatically infected and giving it to one of our patients. I think the CDC and NIH have already decided that they would like to have all adults get another booster. It's not a done deal yet. It has to be approved by the FDA, and I think there's a subcommittee of immunization practices, but I think we can expect that to happen. And the whole idea is that the only way we're going to stop this virus is to get it where it can't mutate and where it can't spread, and the only way to do that is through vaccination. So with that said, I think that was my big piece of what I wanted to get over. You know, I talk to patients all the time that have not been vaccinated. We go through potential side effects, we go through everything, and I'm happy to talk to anyone, anytime about the risk benefits of vaccination. I can't stress how important it is that we just do this. This is how we're going to get back to our lives, is if we get vaccinated. And I just hate to see these people coming in our hospital, dying in our ICU because they didn't get a vaccine. And I've now seen it twice this month. So please, 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 if you haven't been vaccinated, get vaccinated. Thank you.
Thank you again, Dr. Collins. We will now field the questions that we have received.
Great, so we're going to start with some that were sent to us early on. If anyone has any further questions, make sure that you're getting those in the comments section as soon as possible. So John, let's start first with, can you explain why sometimes the numbers that are shown by the New York State Department of Health or the CDC compared to the numbers that we post here in Clinton County are different?
Sure. Thank you, Molly. The case number CCHD shares will be the most accurate picture of COVID in Clinton County. These include active cases that are in Clinton County during their infectious period. Sometimes this includes people with permanent residences outside of Clinton County, like college students who are living here while infectious. New York State and CDC may be including some of these people in their home county rather than where they are physically present when they are sick. This also means people who are not in Clinton County while sick, say away at college in another state, may be incorrectly counted in Clinton County numbers by those entities. So we have a lot, be mindful, we have a lot of people who live outside of Clinton County but work in Clinton County, so that bears weight on that answer too.
We're seeing some neighboring counties as well as stores requiring people to wear masks again. Is that an approach Clinton County will be taking?
At this time and continuing into the near future, CCHD is strongly recommending that everyone, regardless of their vaccination status, wear masks while indoors. Though it is not a mandate or requirement, it is best practice at this time, and it simply makes common sense. I will refer to that very often, common sense.
Is the county concerned about another potential shutdown?
I think shutdown is probably too tough of a word in this case, to be honest. It is possible that we may be looking at layered prevention methods, step by step, if we have to look at a school or a couple of businesses, as we've done in the past where an outbreak occurs. Those may be shut down, closed for a short-term period, 10 days. But no, I don't think we're looking at that necessarily as a whole county, as a whole, our whole municipalities here that we're having. We're not hopefully going in that direction. And we should all be very grateful that we are weathering the storm right now, the Delta variant, not too terrible right now. So, and I credit the public and our great vaccination rate that we have. There's still more to go. And the discipline that all of the public has learned from our first go around with this.
And what is Clinton County's plan in the event of a potential outbreak in the community?
Again, I think the key words to remember on that are step by step. We look at every case, we look at every location where these cases work, live, operate. We always continue to monitor cases and the places of potential spread. We will continue to share pertinent information with the public as we always have done. There are plenty of preventative measures that we can start taking now to help reduce the chances of something like that impacting our day-to-day operations. Wear your mask indoors, especially when there's crowds. Bigger the crowd, more important than masks. Avoid crowds, high-risk activities, wash your hands frequently, and definitely get vaccinated.
As fall is approaching, are we worried here in Clinton County about a spike in cases as more people stay indoors?
Of course, that's one of the variables that we always consider with regard to potential spikes in cases. More people indoors. We know the chance of transmission is higher indoors than it is outdoors. It is best to practice, again, common sense, good thinking, to avoid crowded indoor as well as outdoor spaces. I say outdoor, I mean outside concerts, gatherings, watching your kids go play sports. Spread out along the sidelines if you can. Be smart. Try to avoid spending time with those outside of your household. Spend the most time, obviously, with your household family in indoor settings, especially if we are seeing those case numbers start to increase even more. Again, remember, we've all been down this road before. We know the drill. And that pertains to the public. It pertains to our SUNY Plattsburgh. It pertains to CVES and all of our local school districts. We've all been through this before. Use some common sense, and we're going to get through this. We're going to get through this. We will.
Last question for you for right now. The pool testing that was mentioned for the K-12 schools, can you explain what sort of test that's going to be?
Yes, we have been working since ballpark May. The state introduced to us some funding for that to have another tool to use in the work with our schools to complete testing, random testing, 10 to 20% of your school population every week or every other week. We still haven't gotten the final marching orders from the state on this for testing, and we have solicited bids for such testing. And lo and behold, our most successful bidder is SUNY Upstate Quadrant Bioscience Laboratories, and we'll be working with them as the primary testing contractor to obtain samples from the students and any staff that we can get involved in that weekly or every other weekly testing. Now, that's very important on this matter. As Dr. Ignetti had mentioned, this test, sampling, is a saliva test, not the deep nose test that a lot of us have been through, and it wasn't the most comfortable thing in the world. It is a saliva test, so rest assured, parents, children out there, it's a saliva test. My son's been doing it for a whole year at SUNY Canton. This is a very doable test and very much less intrusive. So we are looking forward to working with not only CVS and our school districts on setting this up, but having it start hopefully within 1 week or 2 weeks of the start of school come September. So.
All right, John, you can take a break for now. Dr. Davey, let's move on to a few questions for you. While he's coming up here, I did see we had one question asking about the vaccination rate for different age groups. If you log on to the Clinton County web page, you can look at vaccination data through the North Country Hub. You can see a breakdown by age group, so feel free to go ahead and look there. Dr. Davey, first question for you. What are our local schools doing to improve the indoor air quality?
The indoor air quality, there have been schools and have worked on air filtration systems. There's a higher level of air filtration that a number of our school districts have invested in, and some have even purchased air purifiers. This time of year, as the students return, many times there is the encouragement of opening windows and doors and having outdoor ventilation as well to keep the airflow as strong as possible. And that's directly tied to the students wearing masks, and also the encouragement of a minimum of 3-foot social distancing, with a more gold standard of 6 foot. So the larger the space, especially in smaller classrooms where students can spread out, is highly recommended.
What are the plans for masking at recess or school-related activities that are outdoors?
Sure, and that's a great question. They're all good questions. The outdoor activities, a mask is not required. And that is true for younger children on the playground, as well as those students outside and staff who are, engaged in athletics as well.
Okay. That's the last question we have for you. It looks like Dr. Collins just stepped out briefly. So John, why don't we have you step back up for a minute here? As far as booster shots go, and third dose shots, is that a mandate at this time? Is it strongly recommended if you have health issues to do that?
The third dose shots, again, being redundant here, repeating myself, third dose shots are for the immunocompromised individuals in our community. And at this time, it's not a mandate, it's not a requirement, but if you're immunocompromised, it's a self-desired want to get that shot to protect yourself, I would think, first and foremost. So, again, the booster shots are for all other vaccinated individuals. The majority of our population, the 72% that are currently vaccinated with first and or second doses, I should say, those are the ones that will want to get booster shots. They're looking at starting that as early as September. It's a big effort. If I have to say and estimate, more like October it's going to happen. I reported that to our county legislature last night. I'm just getting a feel for the timing of it, and it's a big effort. I mean, you're going to get everybody again, so.
Thank you.
Mm-hmm.
We had a question here on why we haven't sent our samples out for variant testing if others have. Can you just explain again for our public on how testing happens through the state for different variants in our positive cases?
Absolutely. The state takes a subsample from given areas, especially those areas that typically have the biggest spike in cases. And we have been blessed. I use that word very strongly. Blessed, fortunate, due to our vaccination rate. That's a credit to the people in Clinton County, and also the discipline of people in Clinton County. We're doing good. We're doing good, and I credit you. I can try hard and speak to all of you as much as you want me to up here, but it's you that are doing this. So we don't seem to be a highlight in the state's eyes other than we're doing well. So they just seem to be testing pretty much randomly across the state, but mostly, primarily in spike areas that they have. So, yes.
Okay. And that is it for the questions that we currently have. So thank you very much.
Thank you, Molly. Much appreciated. No more questions? Very good. Then I will give you my canned closing. I work hard on this. Thank you to all of our speakers, and thanks to all of you for watching this live event. Again, a closed caption recording of this session will be available on CCHD's YouTube channel later today. Take care, everybody. Get vaccinated. Be well. Thanks.